This is the most common, CIDEX. You're going to hear that a lot. It's the most common one that we soak instruments in. So you're going to have a dirty area, usually a sink area, and you're going to soak the instruments in that for however long it tells you to do it. Usually it's about 15 to 20 minutes. You soak them first. And then you're going to put on all of your PPE, which stands for?
Personal protective equipment.
Good. So you're going to put on your personal protective equipment. You're going to go over and you're going to scrub those instruments, okay? First, after they've soaked, before you dry them, before you put them in here, right? So what you're doing is you're getting off all the, hair and chunks and skin and all that fun stuff, right? That was just in this person's skin. So you're going to scrub all of that off. You want to make sure if anything is hinged, you got to make sure that you open everything up, you get all in there. Now, most offices will have like a little brush that you can use. They come already in a little package. You open them up, you scrub it. Now when you're scrubbing, even though you have all your PPE on, you want to make sure that you're scrubbing away from you. Okay, think about your toothbrush when you're getting in a really hurry and you're in front of the mirror and you go like that and it goes, okay? Think about the same way. If you're brushing towards yourself, right? Even though you have your PPE on, you still don't want to expose yourself that way. So always brush away from yourself and down. So once that's done, and then you rinse everything off, you're going to set them over on paper towels on the side of your dirty area, or sometimes they use linens that they will send out for a cleaning service. And sometimes you'll set them on the dry towels. It just depends on your office. Most of them just use paper towels, okay? So you just set them, and when you set them there to dry, you're going to leave the hinged instruments open to make sure they get dry all in between. So you're going to leave those out to dry. You're going to go do a couple patients. You're going to come back. You're going to check on them, make sure they're dry. When they're dry, then you're going to start setting them up into your paper. So go ahead and take any of them that you have that's hinged and open them up and take a look at it. Now anything that's hinged, we want to keep open inside of our wrap. So you're going to put a cotton ball right in between that here, or you can put it between here wherever it's going to stay for your particular instrument that you have. Okay. The other thing you want to be careful of is if you have a tip that's sharp, okay, like let's say these little towel clamps, okay, these ones are really hard. These are sharp, so you're going to put cotton over the tip of those, okay. You don't want them to poke through your paper, okay? So however you can set that up, sometimes you can do both with this, see? Yeah. It's not pretty. It's just a matter of keeping it open and covering that tip so that you don't get poked. So the first one, you're gonna go ahead, you're gonna set down your paper like a diamond. So twist it. And you're gonna take your first instrument and you're gonna set it on your paper right in the middle. Yep, open. You're going to take your second instrument and you're going to place it right next to it. Okay. Now let's say that everything you have opens and closes, and it has thumb, places for your thumb and your finger, right? Yeah, we're good. Okay. So make sure that you flip it the opposite direction. So on your paper, it's going to look like this. See how there's more space? If you put them both like this, they're going to overlap each other and hit each other and go like this.
You can't have them touch.
You can't have them touch. That's the goal. Okay? So here, and then this one would have cotton in it to keep it open, and sharp right here. Okay? That's the particular ones I have, and you have them here. Now, we're going to go ahead and do the next layer. This is where our gauze comes in. We're going to stack these on top. So you're going to just put your gauze right on top. Okay. Sometimes if you have to open it up to make it work, you can do that. Open it up. Stack it on top of it. Okay. And you're going to do your second layer. Now, what instruments are we putting on here? Well, let's pretend that this particular packet is a suture removal tray. Let's pretend that that's what it is. So you're going to be putting in whatever instruments go in Dr. Smith on Mondays suture removal trays, okay? And then on Wednesdays, Dr. Jones uses laceration repair trays, and you know what their instruments are. Those are the instruments that you put in each packet. Does it make sense? So we're pre-packaging for each scenario that may be used, okay? So we're gonna put this in there. You're gonna put your cotton in there. You can even wrap them in gauze, whatever you prefer. Most doctors' offices are gonna want you to use cotton balls though, because they're cheaper than gauze, okay? But the gauze, you have to put in between the layers of instruments because they can't lay on top of each other. So you're gonna put those on there. So go ahead and do that. Okay, your second layer.
Question. Do you need 2 cotton balls for?
Well, that one is already gonna stay open,
Yes. So
but
you just,
it's sharp on the tip, so
can
you're
you
gonna,
go like that?
if it works,
Okay.
whatever works. Okay? All right, so we have 4 instruments on here. Okay, so stack them on there. Now, here's what I used to do, okay? I would take a bunch of gauze. After I had all my instruments in there, I would take a bunch of gauze, depending on what my doctor liked, and I would set it right on top. So when it comes out of the autoclave, they have now all this sterile gauze that they get to use in their procedures, okay? It's much cheaper than ordering the pre-packaged ones. They're about this big, and they have like 50 or 100 gauze squares in each one, but those are expensive. So a lot of offices won't order them prepackaged. They want you to do these individual gauze like this, okay? That's how I used to always do it, okay? So find out,
Or you want gauze?
you're gonna layer it, so it's gonna be 2 and 2. So 2 on the bottom and then 2 on the top. So you do layers.
How do I wrap this guy?
That would be gauze, because you can't really do anything with cotton for
Can I
that.
get more gauze?
Just you can just
Does it
practice.
matter?
Yeah, just put it right around. There you go. We're good. Perfect. Okay. So now, and make sure it's right in the center. Okay. Now we're going to start wrapping. So take the bottom point and fold it to the top point. Towards it, not actually touching it, but towards it. Okay? And then just the inside layer. Not both layers, just the inside layer. Okay? Folding it towards the top point. It's okay. Fold the bottom point up.
That was it.
And then turn it. Doesn't matter which way. Now, you're going to take this point on the corner and wrap it and pull it up towards the top point. Point to point. Yep, it's like making envelopes. Point to point and fold it and make sure that the lines are straight. Okay? And you're going to fold this little piece back. And that's my mistake. I forgot to do that on the first one. The first one, it folds back too. Okay? And then turn it. Do the next one. Point to point. Fold it back. So right now, this is what you should look like. Okay.
I don't know if it's
It's not going to be perfect, and it takes practice.
Yours is perfect.
Well, I've done hundreds and hundreds and hundreds of them. Okay? And then this little strip right here, see how it says steam indicator strip? So this one, you're going to put the date on there. You would put your initials. You could also maybe write what doctor it's for. You could say what kit it is. Whatever your office wants on these little steam indicator strips. Usually it's just your initials and the date, but again, each office is a little different, okay? So you're going to write the information on this. And what happens with this is you see the little blue box that's on here? Once it's been sterilized and it's gone through the autoclave, it's gonna turn black. So it's exactly what it says it is. It's a steam indicator strip. So it indicates to you that it's been through the steam, right? Okay, those actually go right inside. We should have put it in first. Okay, and then here, and then we should be here. Now we're gonna take this last one, fold it down. And fold the little point back. So we're gonna look like this. Okay. Should have a nice little envelope.
Or something like that, right?
Now, we're gonna do it again. Okay, do it again. Start at the bottom, point to top.
And we're pulling the corners back too
Yep.
this time?
Goes back. Okay, turn it, point to point. Make sure you're watching the points, that they are point to point. That's how you keep it straight. Oops, I just got lost. There we go, point to point. Okay, you should wind up like this. And some of yours might be a little bit bigger, a little bit smaller, depending on the size of instruments that you used. Okay. You got it? Okay. Don't be afraid to pull it kind of tight. We don't want loose spaces in there. Okay. Now this last one, you're going to bring it down over top, just like you did. But this one, you're not going to fold the little point over. Or you're not going to fold it back. If you have space, you're going to fold it over like this. And if you don't have space, you're just going to leave it. And you're going to put the tape straight across. So mine, I can fold it over just because of the size that it wound up being. And I'm going to put my tape across here. And when you take your tape off, you're going to notice that there's a little flappity flap on there. You shouldn't have had to search for the end. And if you did, it's not one of my students. And then when you tear it off, you're going to leave this little flappity flap on there for the next person, right? You're going to be nice. You're not going to make people search for the end of that. Okay, so you're going to fold it over. Once you rip it off, you're going to fold it over. And also what this does is this gives a little tab for you and makes your life easier, or anybody else who comes in to open this up, to grab it. See it? Yes. We're very happy with the little tab. Yes, we are.
Very square.
Yes.
My boyfriend does it the opposite way.
It's
That's
because
why
not your
he gets freaked out
instruments
about
that
the
are in
team.
there.
Square.
Beautiful.
Should have traded me the style.
So notice on your tape, it has little lines on it. See the little lines? So those also are steam indicators. So once we put them through the autoclave, they're going to turn black. So we know that it's been autoclaved. This package has been autoclaved. And then when we open it up, the little indicator strip on the inside is going to be black also, because it's showing that it's been through it, right? So on this tape, what you're going to write? Today's date. Your initials. Also, what is inside?
I forgot.
Just pretend. Suture removal kit, laceration repair tray, incision and drainage tray, whatever you want, okay? Doctors will even have their own names for things, whatever they want. Okay, so make up something, write in there what's in there.
Oh, so you just put the whatever tray, not the equipment.
Sometimes they may say just autoclave all of our hemostats, and then you're gonna make a whole packet of hemostats. You never know. So then you're gonna put hemostats.
Oh,
Maybe they want all the operating scissors done together. You're gonna put operating scissors. So whatever is inside is what you're writing on the tape, right? Because how else are you gonna know what is in here if someone doesn't write it on the tape?
You have to open it up, right?
Yeah, you'd have to open it up and then it's exposed, right?
The guessing game.
Yeah. Okay, so you're gonna put today's date, your initials, whatever's on the inside, and then sometimes certain offices will say, I want you to put the doctor that it belongs to. Because each doctor, like I said, is gonna be different. Some, you know, some may want certain things in a suture removal and others may not want those or may want extras. So let's say, you know, Dr. Jones likes, you know, 3 extra hemostats. You're gonna put that that's that doctor, that's the packet that it belongs to. Does that make sense? Okay? All right. So you're gonna write all that on there. Now you're gonna take your little packets and we're gonna go over and we're gonna put these in the autoclave. So let's go. Bring your packets with you.